Good day. My name is David Carlisle. I am an adult with CHARGE syndrome, rare genetic syndrome. Um, Born in 1979, one of the earliest patients who has CHARGE, and I wanted to talk to you about being an adult with CHARGE and what I have gone through during my life. Um, it's simple to say that the road to adulthood and living as an adult with CHARGE syndrome comes with many challenges, and it can be lonely, yet a very rewarding learning experience. Someone who is a role model for me would have to be Dr. Martin Luther King Jr., who said he wanted little black children to play with little white children and not judge anybody by the color of their skin or by their differences. And as I wish that were true, but folks with differences do experience issues, as we see consistently in the news and life, and with our families and with ourselves. Um, and they see it by bullying, being bullied and discriminated against. Well, in my early years, I had this happy persona. I always wore a smile on my face, and I showed being happy. It was a great characteristic for somebody going through so much pain and trauma. Doctors told me it was okay to cry because it was painful, yet I always smiled. Um, However, early years of being happy didn't always stay there. It was impermanent, and I had trauma from infancy up through young adulthood due to many invasive surgeries and feeling abnormal of having an endocrinologist measure my genitalia, um, uh, without really explaining to me what he was doing. Suffered all types of abuse through the years. I have always rejected myself and been rejected by others due to feeling different than my peers. Adolescence, I did have successes. I won music awards, writing contests, speech contests. Challenges, I was depressed. Had to change the medication with testosterone that led to isolation and making it through school, and went to undergrad with no goals or therapy for going through what I have had to go through. I suffered emotional paralysis during these times, these years, and developmentally paralyzed while others were changing developmentally and emotionally growing. With my education, I did go to undergrad school. I changed my major more than 5 times. I was living a lonely life, rejecting myself, rejected by peers, rejected by any love interests. After a while, I decided to major in something that would get me a degree quickly. And I graduated. And found a field that worked for who I am. And now I'm doing great work for people who are undervalued, underprivileged, and with work, I started to begin unfulfilling work and in a hostile work environment, being harassed for my disabilities and for being different. After a while, I took a leap of faith to social services to help people with special needs and help them to fit into society where I could model for them how to do so. I learned to become a better worker. Do I trust my manager to have empathy and understand what I am going through, to understand the mental illness or the physical implications that comes from having a rare genetic disorder. I had to learn, what is my narrative or role at work? How do I use my skills and talents and gifts? I came to assess myself biologically and with my medical issues. Collarbone in the eye, my left eye is misshapen, but with new contacts, I'm able to wear contacts. I have heart irregularities. I've had early transient stroke, one carotid artery, heart and veins are backwards, family history of heart disease. I have bilateral choanal atresia. That was when I was born, a surgery performed my second day of life, many more after that, and many sinus infections during the years. A lack of development. I have a difficult time walking until I was 2 years old. I've had many difficulties with processing information quickly. Hypogonadism, long term, being on growth hormone for life. I can't reproduce. It's difficult to find a mate who doesn't want a biological child of her own. And there's just sadness growing up, finding out that I can't have any of my own biological children. Deaf in my left ear. It's tedious to keep telling people that I can't hear. Difficult time finding school scholarships due to hearing well in my right ear. But also my ear anomaly. Misshapen ears that I have that people have told me, that look ugly, usually by kids in school. Psychologically, with charge, I've had anxiety and depression, attention deficit disorder without the physical hyperactivity. Bipolar 2, could this be due to hormone imbalance? Stress symptoms, tension, irritability, hypervigilance, fatigue. I have chronic post-traumatic stress disorder, which is not diagnosed in DSM-5. However, it's very indicative of what most people go through having suffered from chronic conditions and traumas. Question about that I have is, could treatment at the cellular level create benefits for treating the chronic PTSD? Another question, could a therapist have helped me to process through all of my surgeries and other traumas as a child and adolescent? Socially, belong to a community. Friends consist of immigrants, refugees, people who are underprivileged. A lack of social connections with demographics that I would fit in if you looked at me, being a white male, middle-aged. Also realizing that to create or enter a social community, it's important to find what our purpose in life is. What are our beliefs? We need to be around those who believe the same thing we do. Love life as an adult charger. As a male charger who cannot reproduce, it is difficult to find a partner who is willing to look at other options. Depending on how much caregiving is needed for a charger, it takes a special woman to be 100% involved in caring for them. Due to having physical, mental, and medical issues, finding a partner is difficult as the dating world is highly judgmental. Note to anybody, dating apps are out and not helpful. Here are my takeaways that I hope you'll take with you. Believe that early years needs for chargers consist of psychotherapists to help them understand their feelings, thoughts, and to embrace who they are. Have an integrative clinical approach where all specialists are communicating with each other on the same level. Have early intervention at a holistic level will be beneficial in the long run. Also support a family unit that understands and empathizes with the charger. And lastly, another takeaway I believe definitely is a community thing. Peer support groups and utilizing healthy coping skills help long-term growth. That's the end and the beginning. My email is carlyledw@gmail.com. For any questions, any advice, any tips, feedback. I am on Facebook, LinkedIn, and Instagram. My goal is to be a LCSW that can provide help for chargers of any age and their families, so feel free to contact me. I'm also interested in furthering research on neuropsychology to understand the behaviors of individuals who have rare complex syndromes like CHARGE. I hope this was a great presentation, and I look forward to doing more, seeing you in person. Thank you.